Hi, Dr. John Torres here on my Doc to Doc series, where every week I talk to experts around the world about pandemic issues, about coronavirus issues, and about health issues in general, mainly to get you information that hopefully you can walk away with that can help you, your family, your friends, your loved ones get through this pandemic sooner rather than later and as healthy as possible. And right now, the topic of the week are masks, because a lot of mandates are being pulled back right now. And so the concern is, and the question is it appropriate? Should we be doing that? And what can masks really do for us going forward? Well, to help me with that, I have an expert on this, which is, thank you for being here. It's Dr. Shira Doron. She is a hospital epidemiologist and an infectious disease doctor at Tufts Medical Center. Shira, thank you for being here with us.
Great to be with you.
Let me ask you this question about what's going on right now with the masks around the country. A lot of relaxing of mandates. What's the reason behind this relaxing?
Well, there are many states in the country that haven't had mask mandates for a very long time. And it's really the most restrictive states that are now announcing the ending of their mask mandates. So this is an interesting time. Why now? The Omicron wave was fast and furious, high cases, high hospitalizations, high deaths. Cases and hospitalizations and deaths are still high, but they're coming down really fast. And I think that there's an appreciation now that if we don't give the public a break from this red alert, all hands on deck, emergency kind of a state that we've been in for so long, that they are going to fatigue. They're not going to be able to sustain this. And we should do less when things are safer and more when things are less safe.
It's interesting because Dr. Walensky, the head of the CDC, is saying, it's too early to relax mandates. We need to keep them in place because we don't want a resurge of Omicron, particularly with the BA2 subvariant out there. A lot of experts, yourself included, are saying, we need to look at relaxing them. And the point you make, which I think is important to talk about, is that when it comes to public health measures, we can't just say public health measures focus on the mask. We have to look at other aspects, particularly schools and community aspects behind this that are also part of public health, correct?
Yeah, I think, there's a couple of points to make there. One is that we have had states that have had mask mandates and states that have not. And through this Omicron surge, where it was a unique opportunity to see the shape of the curve in different states, because this variant really came here kind of all at once. What we see is that states that did a lot in terms of restrictions, their curves looked pretty much just like states that didn't do a lot. And, I think that we're really going to see when we take a step back from this is that the virus does what the virus wants to do. There's not a lot that we can do about it. Where does transmission happen? It happens in people's homes. It happens in private settings, predominantly not where mask mandates are going to have an effect. Now, the CDC's color coding scheme for where there should be a mask mandate and where there shouldn't was developed a long time ago, before we had things like vaccines and therapeutics. So I think those need to be reevaluated to some extent.
But you're not saying that masks are useless. There's still some utility to masks.
Absolutely. I mean, we depend on them in the hospital. Absolutely. So we wear surgical masks when we're with each other. We wear surgical masks when we're having close contact with patients who aren't thought to have COVID, some of whom do have COVID. And so surgical masks in and of themselves are very protective. Now, the gold standard is the N95, and there are other types of masks between the surgical mask and the N95. And the good news is that the supply chain is no longer constrained like it was when the CDC first recommended masks in April of 2020. So people who want to stay protected can now use those masks to protect themselves. So that old phrase, my mask protects you and your mask protects me, that's obsolete. We don't need to do that because we're not making cloth masks at home. We can take control of our own protection now.
There's arguably a difference between mask mandates and mask compliance. And that compliance is what we've been trying to work on through the messaging getting out there versus the mandates, because having a mandate doesn't mean people are necessarily going to comply with that, correct?
Well, I think that's true. And I think, it's different whether you're talking about grocery stores or schools. Here on the East Coast, when you're talking about mask mandates in schools, they're enforced. And the result of that is that there are some contentious relationships right now between school staff and students And, school for some of these students is not a happy place. And so that's one of the many reasons to be talking about removing some of these mask mandates for states, for towns, for schools.
You bring up a great point talking about schools. Is there a difference between relaxing school mask mandates and relaxing community mask mandates?
Yeah, there are differences. And one of the arguments for keeping a school mask mandate, even if the community doesn't have one, is that school is a place where people, particularly the students, don't have a choice but to be. Whereas you, if you are high risk or risk averse, could choose not to go to the grocery store and have your groceries delivered. So I can understand why those things don't always align. At the same time, I'm a proponent of looking to relax school mask mandates over the next few weeks because of the place that we're in the pandemic, the idea that we need to start treating COVID-19 like other viruses. We're in a very different place with vaccines, with a lot of immunity, with therapeutics that are now available.
When I go to the grocery store or I go to a different store, oftentimes here in Colorado in particular, there aren't a lot of people wearing masks, and I wear one. Is my wearing of the mask, is that effective even if those around me aren't wearing them, or is it helping at all?
Yes, but it really matters what kind of mask you wear. So if you are wearing a mask that fits well and filters well, then you are protected. I mean, I put on an N95 and I take care of COVID patients, and some of them are very short of breath, and I don't ask them to wear a mask. In fact, we didn't even think about asking our COVID patients to wear a mask in the hospital until months into the pandemic, because it's not something we ever asked sick people to do. One way masking works, it is protective.
Let's talk about masks and the effectiveness. You brought up N95. That's essentially the gold standard of masking. And for people that don't know, in the hospital, they do a fit test on these N95s. And the way they do it, depending on what hospital you're at, oftentimes they'll do what we call either a fructose or a sucrose challenge, where they'll put this plastic thing over your head and they'll spray in a little fructose and see if you can taste it. And if you can, it's not fitting well, because if that can get in there, a virus can get in there. And so you want it really tight. Most people don't fit it like that. So KN95s, or N95s, even for them, not fitting that tight are still fairly effective, correct?
Yeah. And so that's an argument that people make that I'm not sure I agree with. And they say, if you are wearing an N95 and you haven't been fit tested, it's like you're not wearing a mask at all. I wouldn't say that, because chances are if somebody fit tested you, you would pass. Most people pass. So, right. I think it is good, but you do not know if you haven't done a fit test, whether you have that really tight seal. I think for most people, unless you see giant gaps, it is protective, but I don't necessarily recommend N95s for most people. I do think that the KN95s and the KF94s, and even the surgical mask, if you wear it the right way and it fits you well, are very protective.
So let's talk about it. So KN95s or N95s than KN95s, a little bit below that, but they're still fairly effective, more comfortable for most people, correct?
Exactly. Although there's a high rate of being counterfeit amongst the KN95s right now.
And that is an issue, and especially the ones you get off the internet. So you have to be very careful with that. And the issue there is it might fit well, but it might not have that middle layer. And that's the important layer, correct?
Well, like I said, I think the surgical mask, the one I wear here in the hospital, even when taking care of patients who may or may not have COVID-19, even with close contact, even immunocompromised patients, and I could be an asymptomatic carrier, I think it's a really good mask. And there are ways to make your surgical mask fit better if yours has a lot of gaps.
Let me ask you about the way, and I was touting this a few months ago, haven't done so much recently, but it's basically, putting a surgical mask on, making sure it fits as best as you can, and then throwing a cloth mask over it to help it fit better. Is that effective? Does that help?
Yes, that's one of the ways to make your surgical mask fit better. That's been studied by the CDC. Another way is the CDC's tie and tuck method.
Right.
There's a YouTube video for that. There are actually products out there that you can put over your mask fitters. There are a number of ways to make your surgical mask fit better, but many people, when they put that mask on, don't have a lot of gaps, and it fits them quite well.
So how close is having a surgical mask, especially, like I was showing there with a cloth mask over it to have it fit well, how close is that to KN95 or N95 as far as protection?
the filtration is essentially the same. So it's really about the fit then. And so if you're getting a good fit with a surgical mask, that's really what I recommend for most people.
And do cloth masks with that filter insert, assuming it fits well? Yeah.
Well, I think that could be okay. I think the issue is that that insert then is a disposable item, and that you want to make sure that it's not getting dirty, wet, torn in there, et cetera, because then it will lose its function.
You know, moving forward over the next 6 months to a year, where do you see us with masks? Do you see us having them in our back pocket all the time? Do you see us just occasionally getting a notice saying, hey, cases are creeping up, start looking at putting masks back on?
Well, I can't predict what policy will do. And of course, I can't predict what the virus will do. But, you know,
What are you going to do going forward?
Well, I do think that there's been a culture shift, obviously, that other countries have always kind of intermittently worn masks based on the levels of pollution, the levels of allergen, and the state of, you know, say a respiratory virus season. So I think that our culture here in the US has shifted, and we're going to accept masks probably forever now in a way that we never did before. I am not my state has not had a mask mandate since May 28th. I generally go out without a mask to places that don't require it. And the main reasons being, A, I trust my vaccine and booster to protect me against severe disease, and B, I don't think I'm going to make it much longer without getting COVID no matter what I do. I think we're all going to get COVID. And just like the other common cold coronaviruses that have been circulating for who knows how long, and we get them over and over again. So I'm not trying to do everything I can possibly do to prevent COVID-19. I'm taking reasonable precautions, but if there's no mask mandate, I don't intend to wear one.
What are those reasonable precautions you're taking?
Staying home when sick, staying away from people who are sick, making sure that my family is tested immediately when they have symptoms, because your family is who you're going to get it from statistically more likely than certainly somebody that you casually see at the grocery store, things like that.
Vaccination, does that fit in there as well?
Huge. Number 1, 2, 3, and 4. So, you know, and that's not as much to protect any infection and any transmission, because we've learned now that at least the existing vaccines their protection against asymptomatic and mild infection will wear off over time, but they're unbelievably effective at preventing severe disease and death. And so they've really turned this virus into something like what we are used to, influenza and other viruses. And so that is absolutely the most important thing we can do right now. The mRNA vaccines are the best option we have. I hope that there will be continued development of new formulations and new platforms of vaccination that maybe will try to have a more durable prevention of mild disease. And obviously we want to get vaccines that are scalable to the entire world, less demand for cold chain, things like that, less demand for needles. I think we have a lot of work left to do in that vaccine arena.
To a certain extent, after 2 years of this pandemic and almost 2 years of wearing masks, are we reprogrammed to where we don't feel comfortable without masks, or some people might not?
You know, I think that there are always going to be high risk people who, in a way, I think this has taught us how to better educate those people to protect themselves against respiratory viruses. I also think that there are many people who are not properly framing their risk in both directions. There are people who are out there unvaccinated who don't realize that this virus can and will kill them. There are people who are vaccinated and boosted who still think that the virus will kill them when it is extremely unlikely. So I think we need to just do a better job at that messaging. We need to stop politicizing this virus and this pandemic and really have some open and honest talking points that everybody can really embrace.
So it's that communication that has been arguably wanting over the last 2 years that has been confusing, and it has added to that confusion among people, especially with masks and vaccinations, unfortunately. But moving forward with the new normal, when will you use a mask?
You know,
Ever?
I think, yeah, Not a lot, but I think, I have a trip coming up that's really important. And so, in a situation like that, where I don't want to get sick with COVID or flu or anything, that might be a time when I kind of step up my mask use in higher risk situations. Certainly to protect others, visiting an elderly or immunocompromised friend or family member is a really important time to be wearing a mask. But I do think that this next phase of the pandemic is where we treat this virus the way we treated other viruses, while kind of figuring out a new way to treat other viruses. But it doesn't mean we do all the things we did for COVID now, up for the last 2 years for every virus going forward, because we lived our lives with what is sort of a reasonable amount of risk.
And again, moving forward, one of the things I often tell people is over the next couple of years, if people put masks on, that's okay. Don't give them a hard time. They're putting masks on for a variety of reasons. And it might be because it makes them feel safe. It might be because they're feeling sick. It might be, like you said, you have somewhere to go. But I think the message should be, it's okay. Let them put a mask on. Don't give them a hard time.
Absolutely. I mean, we have to respect each other's choices on this. And that's one of the very valid concerns of families about the idea of dropping mask mandates in schools. Is that their child who wants to wear a mask or should wear a mask will feel different or ostracized. So I really hope that that is something that school administrators take very, very seriously, that children should be encouraged to wear masks if they want to, that everybody should respect that decision.
And moving forward, if there are continued outbreaks, should this decision be pushed to a local level as opposed to a state or federal level of saying, masks, you decide at the local level, and of mask suggestion versus a mask mandate? Where do you lay with that?
I think that, again, that's policy, and, I don't make policy, but, I do think that to some extent, when you get hyper local, like a school district, they may not have the tools to make these types of health decisions going forward forever. I think when you're talking about a community, a health department, it makes sense for them to assess the situation on the ground. I do think that we need to start moving away from mandates, from very draconian restrictions, because the public is becoming, it appears, less and less likely to want to be told what to do. And so that's where this really clear messaging, explaining the reality, the situation, the level of risk to the public so they can make their own decisions. Again, because one way masking works, we can potentially move away from mandates, unless what we're seeing is, a new virus or even a variant of COVID-19 that is both more deadly and evades existing immunity. And we're seeing overwhelmed hospitals again. That's where we're going to need to rethink that question.
Excellent. Thank you very much. Could not have said it better myself. Appreciate your expertise in this conversation, because I think this is a conversation that's going to keep going on over the next weeks and months as we start getting, hopefully, around the corner here, seeing the light at the end of the tunnel, all those things we talk about with the pandemic. But as you know, the virus is going to be with us for the rest of our life. And so we're going to have to deal with how to deal with it. And having experts like you certainly helps a long way. So thank you very much for being here with us. Again, this is Dr. Shira Doron. She's an epidemiologist and the infectious disease doctor at Tufts Medical Center. Shira, thank you very much.
My pleasure.
Bye.